I am here today with Dr. Christina Campbell in Michigan. We are super excited to have her join us today. Just a little background on Christina. So Dr. Campbell, grew up in Florida and went to medical school in Maine, osteopathic medical school. So have a special place in my heart for her as a fellow DO. And then she ended up dual boarding in internal medicine and emergency medicine. And from our discussions, it sounds like internal medicine, she just hit some frustrations and felt like ER was really the better fit for her. And so spent over 20 years working in the emergency department, and through that process and sort of her own health journey, ended up finding functional medicine and started her own practice, which is Institute for Functional Regenerative Medicine and Naturally Free from IBD. And so we are so excited to have Dr. Campbell join us today. Dr. Campbell, thanks so much for joining us.
Yeah, absolutely. I'm super excited to be here. Thank you for inviting me.
Yeah, of course. All right. So, Dr. Campbell, I mentioned briefly in there sort of your own journey of what that's been like, and obviously a brief bio doesn't do justice to sort of your whole life story and where you've been. I think it's helpful for our viewers and patients to hear a little bit of your story as far as why you ended up doing what you're doing and the sort of the personal aspect of that, because a lot of them feel like, oh, these doctors don't really know what I'm going through, right? And so give us some idea of why you do what you do now.
Yeah, absolutely. So my story in medicine, my path in medicine actually began when I was 12. So I was diagnosed with an autoimmune disorder called Crohn's disease, inflammatory bowel disease. And in the beginning, it wasn't an awful thing. It was really pretty minor, and I responded to medications very easily. But at the age of, as I got older and went through, my adolescent years, it got worse, and had a near-death experience at 14 that, I was in the hospital for so long. I couldn't even walk when I got out. I had no muscles left. I was completely atrophied. And I was allergic to the only medicine on the market back in the 80s. So they had to desensitize me to that. And it was kind of a crazy time, right? I mean, like all of my dreams, all the things, when you're young, you have your dreams about what you're going to be and do. And they were just all kind of blown to bits, And so then I had to kind of find my way again and figure out, how am I going to get through this? When I was 14, I was told, you're not going to make it. The surgeon said, if we don't take out your entire colon right now today, you're not going to make it to your 15th birthday, which at that time was 2 weeks away. Right. So that was kind of like that scare tactic that honestly made me really angry as a patient. I felt threatened, and I don't respond well to threats. And luckily I had this amazing, physician, Dr. Serta, who has since passed, so God rest his soul. He's the guy who saved my life, my gut. He was just willing to work outside the box, because I told him, no, I'm not going to have that surgery right now. There's got to be something else we can do. And it didn't make sense to me if I had Crohn's, because it's not curative. And I was sassy little girl, and I had my parent, my stepfather at the time was on staff at the University of Florida. Shands Medical, Shands Hospital was where I was at the time. And my dad was on staff in the dental school. So I had them pulling articles for me to read on Crohn, so I could know what the hell I had and what I needed, what was the story for real and what was the research like. So I had nothing better to do laying in bed for 2 weeks. So I was highlighting and reading through all these articles. So I just said, it doesn't make sense. Like, it's not curative. So then what's the point? And I'm only 14, for heaven's sakes. I'd like to live a productive and healthy life. And I feel like this is a sentence for disability and misery. Right. And the surgeons didn't like that a lot. And I get that, but I just refused. And luckily I had parents that were supportive, because they could have, as a minor, they could have signed me away. Right. And that was the other thing that was really, I'm very, very grateful, endlessly grateful for my parents supporting me in that decision. And it's kind of funny. So Dr. Serta, who, he's a Catholic physician who had, I think, 5 daughters. And I said some pretty intense things to him when I was telling him my reasons for not wanting to have a colostomy bag. And so he said, can I go talk to do you mind if I talk to my girls about it so I can understand where you're coming from? And I'll come back on Monday. This is a Friday afternoon. I'll come back on Monday with a plan. I said, fine, I can do anything. I'm just not going to do that, And at the time, there weren't a lot of options. And again, I was already allergic to the only medication on the market other than prednisone. And which was why the surgeons were adamant that surgery was the way to go. And I get where they were coming from now that I know more. But he came back and he said, look, let's just put you on complete bowel rest for like 6 months. Just you're not going to eat or drink anything. And they put in a central line, a Hickman catheter, and fed me that way. And I went home with a Hickman catheter, and 24-hour hyperalimentation is what he called it. Somewhere out there's a, because I remember signing all the release forms, right, for all the things to have papers written. I can't find them for the life of me, but supposedly he was going to use this story. I know he took this, my story to conferences, the case study to conferences and things to get other people's input. But as it turns out, he saved my intestine. I still have yet to have a single surgery for Crohn's, which is pretty amazing given that I'm 51 and I was told at 14 I wouldn't make it to 15, right? So I'm endlessly and eternally grateful. And then, I just felt like because of that, I just felt like we needed more doctors who were willing to think outside the box, right? And who might question standard of care, and for a patient who didn't want to do standard of care. I just felt like we needed people who were thinking, more prevention, more conservative, more, less surgical approach if possible. And so I felt called to medicine. I felt like that was where God was leading me. And so I jumped in at 14. I decided that's what I was going to do, put my head down and, went for all the straight A's and, the drill because you've been there. So, and my goal was to help, as many people as I could with Crohn's and ulcerative colitis down the road. And during training and whatever, it just turned out I was really good in the emergency department. I was just a natural for whatever reason. And, keeping calm in the chaos was something I was very good at. But it didn't change the fact that I wanted to work with Crohn's and ulcerative colitis patients. So I did a dual residency in internal medicine and ER, and that was why I did it. But I loved the clinic in that I love interacting with patients, and they hug me and I know who they are, and that's fabulous, but they just never got better, and I felt like I was treading water and I was wasting my time. I wasn't helping anyone, and my skills could be used better maybe in the ER saving lives. So that was really why I jumped into the ER as as the only place I was practicing for 23 years. But in that journey, you're saving lives on one hand, right? And that's amazing because conventional medicine, the one thing it does well is save a life when you're hanging on, right? When you're just barely hanging on. We do that well in conventional medicine, but when it comes to chronic illness and chronic medicine or chronic disease, we drop the ball. And what I found was, there were just people, you knew them. They were in all the time. And no matter what you did or said or tried to help them with, they were on 20 medications and they felt awful. And they just kept circling the drain until finally one day they came in right on the other side of the ER where you had to save their life. And I found that to be very, very frustrating, and when it came to Crohn's patients in the ER, you see, the ones in the community because they just don't ever get better or seemed like they didn't get better. And there was always the pain issues and the chronic, just additional autoimmune diseases that, just things would compile, right? And they would come in with one disease and then they'd have 2 or 3 autoimmunities by the time it was over. And, bowel obstructions and any number of things and on all these medications, but still in pain, unable, on disability, unable to do the things they wanted to do in life. And I found that frustrating to watch. I just felt like I could do something better somewhere else. And in my own health journey, I found a lot of natural things that helped me to keep myself in remission and eventually even get off medications, if you can believe that. I've been off all my medicines for 3 years and in remission. And, I don't have pain every day. I lived in pain every single day of my life. It was part of my life. And I felt, I just felt like, well, that's how it's going to be, right? Just accept it and buck up and move on. Because what are you going to do? Sit around crying about it? I mean, to me, that wasn't really the option that was best. But it was hard. It was really hard to live in pain all the time, to be inflamed all the time, and I didn't want to tell any of my colleagues because, frankly, as a woman in medicine and in a male dominated field, it's sometimes a little bit of a cutthroat, and I didn't want to give anyone any ammunition. So I didn't tell anyone. The only people who knew I had this disease was my parents and my husband to be. That was it.
Wow.
And maybe my very closest of friends, and that was it. And I kept it on the DL for ever until, well, now it's all over the internet, but until I decided there was a better way. And I really thought that, sharing my story and sharing some of the things I've been through and how I've successfully gained remission using natural methods. I just felt like I could really help a lot more people with Crohn's and ulcerative colitis by sharing my story. So now I'm out of the closet.
I love that. Thank you, Dr. Campbell. It's just an amazing journey. I didn't realize you got to that degree of sickness when you were so young, to make that big of a decision at that age is amazing. I would say inspired that you felt like maybe there was something else you could do, and hooray that you found a doctor willing to help you through that. So that's awesome. And it's awesome that it's sort of inspired you to take this pathway, and we'll talk more about sort of what those options are as far as, I know we're going to have people who hear this and say, okay, so tell us what we can do then for Crohn's and ulcerative colitis. What did you do and what can we do and what's out there? And so maybe we'll take just a little bit of time to talk about that as far as, there's the conventional medicine treatments. You mentioned prednisone or methotrexate or these disease modifying agents that are pretty potent in affecting our immune system. So what type of an approach do you take when somebody comes to you with Crohn's and ulcerative colitis?
Yeah, absolutely. So, I mean, of course, it's individualized. It's everybody's different who comes to the table. And I know you know this, but, the most interesting thing, I think, to me, as I started down this path and learning, was to realize that you could have 20 people diagnosed with Crohn's disease, and every single one would come to the table with a different root cause. And that to me was fascinating because, in conventional medicine, we're practicing recipe medicine. Everyone who has it gets their biologic. They get their anti-inflammatory, their narcotic for pain, their bentyl for the contraction pains that you get. And, everyone gets the same treatment, and you're never actually dealing with the underlying root cause. So you're basically putting on medication Band-Aids that never really change the underlying root cause or fix the root cause. And it's kind of like if you think about a car with a gas tank that's leaking and you're empty and you just keep going to the gas station and putting gas in, but you're not really solving the problem, right? You're still going to stall out on the highway eventually. So it's really important, right, to figure that out. So finding root cause is the most important piece initially. Trying to figure out where that is. A lot of times there are, leaky gut issues with Crohn's. I mean, almost everyone has that who has Crohn's, just in the end, because it's just the way when you have that disease, it's an inflammatory bowel disease. So when the bowel's inflamed, it becomes leaky, and usually just continues to get worse over time. So trying to fix that is usually where I start. Yeah.
Mm-hmm. And maybe let's dive into that just a little bit, because this has a lot to do with sort of my area of passion in brain health and that interaction between leaky gut and leaky brain and that gut-brain axis and all of that. So let's just take a second and kind of talk about, number one, what is leaky gut? It's funny when we talk about that, you and I talk about it all the time. And so we sometimes forget that not everybody understands that terminology. Absolutely. And, I had somebody in the clinic yesterday who said, I don't have leaky gut because I don't have diarrhea. And I said, what do you mean? She said, isn't that what leaky gut is? It just leaks out of you. No, and so I guess just making sure that, number one, what is leaky gut? And then how does that inflammatory bowel disease that creates leaky gut, what does that do to the rest of the body? And are there symptoms that are often tied to leaky gut and inflammatory bowel conditions outside of the gut?
Yeah, absolutely. It's a great question. So this is how I always like to explain it. The cells of the gut are kind of put together super tight like this. If this is one cell and this is the other. And in the middle down this section is called the tight junction. And it's meant to be super tight together so that no large molecules can go across between the cells. Mm-hmm. And what happens when you get leaky gut is you get this inflammation as these start to separate. And now all of a sudden, these larger molecules, larger proteins are able to go across into the bloodstream, and they're not supposed to be there. So then your immune system freaks out and says, oh my God, I'm being invaded by these crazy proteins. And then you start developing antibodies to those proteins. And those antibodies create inflammation, and they create, systemic. So your whole body becomes inflamed from these. And you can have all kinds of reactions, from acne to, skin rashes to, back pain, joint pains, foggy brain fog, all kinds of things that can come from that. And, with inflammatory bowel disease, it's very common to have uveitis, which is inflammation in the eyes. It's common to have sacroiliitis. These are, very common, which is, joint pain specifically in the low back where your butt meets your backbone, if you will. And these are very common other diagnoses that come along with inflammatory bowel disease. But there's inflammation in a lot of places. And so, yeah, that's the cause of it. And of course, 3/4 of the neurotransmitters are created in your gut. So when your gut isn't working correctly, you don't have the neurotransmitters you need. That's where they're made. They're not actually made and used. They're used in the brain, but they're made in the brain, as you know. And so then you don't have all the transmitters that you need for your brain to work.
Mm-hmm.
And that leads right into leaky brain, which I'll let you answer because that is your specialty.
Yeah, for sure. No, it's so true. And as you mentioned, you get that opening of the tight junctions, things come in, you get the bacteria that comes in, that LPS, the lipopolysaccharide that the bacteria makes, and you get this whole slew of inflammatory process that creates and wreaks havoc throughout the body, including the brain, affects that blood-brain barrier and affects the immune system there in the brain. So certainly then you get the brain fog and everything is kind of cloudy. And you mentioned several other conditions that go along with that. And we know that pretty much every autoimmune condition is tied to some degree to leaky gut, right?
Yeah.
The body starts reacting to something as a result of that gut being, that intestinal lining being impaired. And so,
as the dysfunction continues to get worse and worse and worse, you start to develop antibodies to your own gut lining.
Yes.
That is exactly how inflammatory bowel disease comes about, because now you're reacting to your own lining, or you develop antibodies to something else. So, to muscle and you have myositis, or there's a million other autoimmune diseases, to thyroid. Right. Now you have autoimmune thyroid issues, but it all begins in the gut, as you pointed out. Exactly. Yeah.
Yeah. So, and you've kind of talked about sort of this conventional medicine approach versus functional medicine approach. And let's maybe get a little bit more specific now on what we can do about that. How do we, number one, heal up that intestinal lining and that leaky gut, shut down inflammation in the gut, and then also start to work on the inflammation throughout the rest of the body and the brain fog and all of that? What do we do as far as on a daily basis, as far as what we're eating, our lifestyle choices, sleep, stress stuff, and then any supplements or other treatments that you tend to recommend for people?
Yeah, absolutely. So, always it's important. If you're working with a functional medicine practitioner, which is ideal, if you really want to get well quickly, that's the best way to do it. And obviously there's a lot of things you can do on your own. But working with someone like you or me or another functional medicine practitioner is really going to get you there a lot faster. That being said, and the reason for that is because, we do good intake, we figure out what your root cause is, and we drive right there. And oftentimes can figure out exactly what's wrong in the bowels, exactly what type of dysbiosis or leaky gut do you have, because there's more than one kind, right? There's small intestinal bacterial overgrowth, there's dysbiosis, there's imbalance. So you can have too many of certain kind of microbes, or too few, or just an imbalance of the whole thing, or parasites, or anyway, all of those things. So when you work with a practitioner, you can find those things out, and then we can drive the therapy directly at that. that being said, one of the things you can do right away, and one of the things I typically recommend to my clients when they start on with me, is to do an autoimmune, low inflammatory diet. And it doesn't mean forever, because autoimmune protocol, although it can reduce inflammation super quickly for you, and help you heal your gut, it's also you don't get as many nutrients. So you have to make sure that you're doing it correctly. So you're still getting the nutrients you need, because that's really important to heal. But I would say an autoimmune protocol, diet for 3 months can really make a huge difference in healing up a leaky gut and decreasing inflammation and improving pain. That was certainly part of what I did when I was bumbling through it on my own, uneducated and just trying to get through it on my own. Now I have all the pieces put together for everyone. It took me 10 years to get here, but I can get my clients here a lot faster. But so starting there, and then having some things that are healing to the gut. One of the things that I found to be incredibly powerful is, bone broth or collagen products, specifically a liquid collagen that's, that has all the pieces in it. And then I also like to use CBD. I don't know if you're familiar with that very well, but CBD can do amazing things for autoimmunity. And if you look on PubMed and just put CBD in and whatever diagnosis you have, you'll find, a slew of information on what it can do. And really, it's if I was ever asked, hey, what's the one supplement you would recommend to someone, regardless of what they had going on, if you could only pick one, it would be CBD. And part of the reason is because we don't have a way to feed that system other than CBD, because it was removed out of the food chain, right? They took all the cannabinoids out of our food chain. So it's really the only one. You can't get it anywhere else. You can't get it through food. You can't get it through sunlight. You can't. So that would be the one supplement that I always recommend, and I find to be very powerful. But also fulvic acid and humic acid products, mineral products, can be very beneficial to healing as well. And I like to combine the two because one helps the other absorb. So that's kind of neat. And then, really from a lifestyle standpoint, getting your 8 to 10 hours of sleep. Certainly as an adult, you need at least 7, but 8 is better. And it has to be quality sleep as well. And many people feel that they're sleeping well, but then if you have a device where you can monitor their actual sleep and how deep their sleep is or how much REM sleep they're getting, a lot of times you'll find that they're not getting what they need. And so, finding ways to improve that sleep hygiene, getting out in the sunlight during the day, because the sun, the sun really tells us what is supposed to be the trigger. It's what our body is used to as triggering all of our hormone releases as far as circadian rhythm. So when you don't go outside and you spend it all inside, your body's very confused, right? It doesn't know what time of day is it. So then when it's time to go to sleep, of course, it's still confused. So so I always tell my patients, one of the greatest things you can do for yourself that will make a huge impact quickly, get up in the morning with the sunrise and go outside barefoot if you can, if you live in a place where you can, or grounded if you can, and spend at least 15 minutes looking at the sunrise. That red light is a signal. The red light that's more common in the sunrise and sunset is a signal to your brain about what time of day it is. And then make sure you do it in the middle of the day as well, and take off as much clothing as you can in the middle of the day so you can also get your vitamin D through your skin, which is what you're supposed to be doing as well. Those are some really great, first steps that anyone can do for themselves and can be really helpful.
Oh, I love that. It's so interesting how the right thing to do for your gut tends to be the right thing to do for your brain, tends to be the right thing to do for your heart, right? And they all tend to go hand in hand. And so I love that. And then the specific nutrients that you mentioned are really helpful. And that anti-inflammatory autoimmune protocol, as far as an elimination type diet or something similar to that, to kind of quickly decrease inflammation, I think is powerful for people, and sometimes intimidating, but I often find that people, when they are willing to jump in 100%, just find such massive benefits from that. So that's great. And the supplements you recommended, the humic and fulvic acids, I love. CBD, there's so much research on, it just continues to pour in. And I think the biggest thing with CBD is just finding the right product, right? As far as quality goes, and something that you trust and is truly there. So it's probably a conversation for another day, but definitely the quality is important, and there's a ton of research on that.
And lab
And so
testing, right? Lab testing is really
lab
important.
testing, right? And find your specific needs is critical. Um, and we do have people that come in, they're either feel like they're doing all the right things, or they're in the process of figuring out how to implement all of these different changes they're making, and maybe they're not quite there. And it's not unusual to get occasional flare-ups periodically. Somebody goes through a big stressor in their life, or something happens, right? And you get this flare-up of in any condition, but certainly in inflammatory bowel conditions, that can be pretty devastating for people, especially when they feel like they're working hard and then things flare up. So what do you do in that situation when somebody experiences sort of that acute flare up? Are there things you can do to kind of quickly shut that down or help them out?
Yeah, absolutely. One of my favorite, and of course, again, goes to root cause. But I like to use a spore-based probiotic. A lot of times that can be very, very helpful in an acute situation like that. I mean, even if it's someone with Crohn's who's doing fine, but then, goes and gets traveler's diarrhea, which can be a trigger, right? This is a really great thing to throw on board really quickly, because it can make a big difference quickly. And, I would say, being gracious with yourself and taking some downtime. For many of us, we just try and push through it because, hey, it's our life and it's how we have to deal with it. At least that's how I felt for a long time. And I just pushed through, and, I had some days that I really should have been a little bit, given myself some more grace and some more rest and taking the time that I needed. And maybe that's not been traditionally my personality, but something that I found I needed to do for myself. So I would say, give yourself some grace, first of all. Second of all, the spore-based probiotic, the CBD, you can bump up the dose. That's, it's highly anti-inflammatory. So, and, you can take it under the tongue. So if you're having if you're having issues with anything you're taking in your stomach, a lot of times people with Crohn's or ulcerative colitis will just have pain from anything they eat or drink when they're in a flare. And so you can put the CBD right under your tongue, and hold it there, and it absorbs right there. It can also be used rectally if that's something that you're open to, because a lot of Crohn's has, distal, lower bowel and rectal involvement. So it can be made into a quick suppository with coconut oil in a freezer. So super inexpensive way to do it. And you just pop that in, and that can help with and it can also work in ostomies as well. So same idea. So there's all kinds of things that you can do. But I would say giving some sense of bowel rest. So not eating a lot of, difficult to chew, difficult to digest foods. I would say go straight to bone broth and water, and try and stick with that, because that is really a healing mix, and it tends to be easier to digest. So those are just some of my initial thoughts based on the question.
Those are all so good. I love that. And I love bone broth. That's one of our favorite things, to make some good bone broth. And this is a sort of different question. So you make these suppositories, rectal suppositories. I honestly haven't heard of people using CBD rectally, and I love that idea. I don't know why I hadn't thought of that before, but that's awesome. Do you have people ever do like fecal transplants or probiotics rectally or anything like that to kind of change up the microbiome?
Yeah, absolutely. Probiotics for sure. I have people put probiotics in all kinds of places, depending on what's going on. Because really, I mean, a lot of times our dysfunction is because we've got the wrong bugs living on us. And they, as you know, they live everywhere, right? They're everywhere. They're in our ears, they're in our nose, sinuses, everything that touches the outside world, they're there. And technically our gut is the outside world as well, because we're it's the tube inside that connects to the outside. And so, I use probiotics everywhere all the time. Love them for balancing things. The only thing is you have to be careful if you've got someone who has small intestinal bacterial overgrowth, then you have to be careful with what you use. You can use a spore-based temporarily for someone like that who's in an acute flare. Those are safe with SIBO, but I wouldn't use your standard probiotics with them, because you're just adding more bugs to the problem.
Yeah.
So you just have to be careful in that particular thing. And that's where, working with a functional medicine practitioner again and having a good root cause diagnosis is important.
Right. Right. No, I love that.
Yeah. And fecal transplant, I mean, that offers a lot for people. There's there's some really interesting literature on microbiome, and it just keeps coming, right? Seems like every week there's something else cool being released, which is along those lines.
So true.
Yeah.
Awesome. So good. So as you've worked with people, and as we've kind of talked, have you had anybody come to mind as far as somebody you could share a success story? You've shared your own success story, which is definitely inspiring for people, and I just feel like the more people hear about somebody else doing it and getting over their condition that they're dealing with, it just sort of gives people a little bit more hope and excitement and motivation to try it on their own. So anybody that you can think of that maybe is a success story you could share?
Yeah, absolutely. So I have one client who came to me as a 20-year-old young lady with a long time history of endometriosis and chronic pain from that. And then she also had an underlying irritable bowel syndrome. And she was, poor thing. I mean, she couldn't travel. She couldn't be very far from the bathroom ever. I can't believe my husband is doing the lawn right now. I don't know if you can hear that lawnmower.
It's fine.
Anyway, so she came to me in just all kinds of pain and just struggling, to live a life, right? She's young. She's got her whole life in front of her. She couldn't travel. She couldn't go very far from home because of bathroom issues. And, she was on multiple medications for her irritable bowel that didn't do anything, birth control pills for her endometriosis, which didn't do anything for her pain. And she didn't like being on them. She didn't feel like it was a good choice for her. But she didn't know what else to do. And so she came in and we started her with an elimination diet, which she did really well with. And she just jumped right in. She's probably one of my star patients because she just jumped right in. Anything I told her, she did it. And, we've got her off all of her birth control within 3 months. And, off all of her IBS medications. She started to travel this summer. So 6 months in, she went on her first road trip as an adult who could drive, right? Like she wanted to go on her own. So she went just for a couple of days in Ohio, from Michigan to Ohio. So not very far. She did really, really well with that. So she was so excited. So then she did another trip and another trip. And each one got a little bit longer, a little bit further as she got more comfortable. And, she's just so excited with the progress that she's made. And she still has some toxic issues that some toxin overload that we have to deal with. But really, honestly, she's 100% different than she was when we started working together. So I'm just really pleased with her. And then I had another really great case, which was maybe for me was an incredibly fun case because it was a mom and baby who were still breastfeeding, and baby had eczema and mom had bowel issues. And so we were essentially treating baby through mom's breast milk. And that was a really neat case because, a lot of the supplements and things that I wanted to be able to give to the baby based on based on the labs that I found with baby, I couldn't give because baby was too young for this or that or whatever. But through breast milk, I could just dose it just perfectly and give just the right things. And it was a really neat case. And baby's eczema completely gone. And now she's a toddler. And mom is, doing much better. And she, as part of, and this will be interesting to you, she had SIBO as her underlying root, and migraines, really awful migraines she'd been having since she was 18 and now is in her mid 40s. And this was the first time that in working with me, was the first time since she was 18 years old that she was able to have a migraine-free month or two. And then she got COVID. So it kind of slipped backwards for a minute, but, and she's working through that, but it was incredible to be able to offer someone, because I know I get migraines, as well. And it's just incredibly debilitating. And, you just feel helpless, and in some ways it was worse than the Crohn symptoms that I had, just because, it's just so awful. So to be able to give that to her was pretty cool.
Yeah, that's amazing.
Yeah.
Well, Dr. Campbell, thank you so much for joining us. It's been an amazing, enlightening discussion. I think we've been able to cover some pretty broad topics as far as the gut and inflammation and sort of all the building block elements that go into keeping and maintaining our health. And I love the little pearls that you shared with us. We'll certainly share those with our patients, and I look forward to trying those out on people to see the benefits there. Anything else that any other last thoughts that you had that you want to share? And if not, please go ahead and just tell us how people get a hold of you if they do want to learn more, and if they have inflammatory bowel conditions that they want to learn more from you about.
Yeah, I would say the only other thing that I'm thinking of that connects the bowel, the bowel and the brain, is that vagus nerve. So just to make a comment on that, where stress and other things can impact your brain, but your brain can also impact your gut and your other organs, because that nerve runs through every organ in the body. It comes from the brain and runs all the way down. And it's kind of like a monitoring system, right? A feed forward and feed backward system. So when things are going wrong in the gut, it affects the brain, but also vice versa. And so stress management, is a really important piece of the puzzle. And very often with inflammatory bowel disease or with autoimmune disease, there's, some childhood trauma or some emotional things that have happened in the past. And that happens to everyone. So, it's nothing to be ashamed of, but certainly can be a piece of the puzzle, working through those emotional traumas to try and release that, so you're not carrying that around, can be really powerful in improving your illness. So
Love that.
yeah, I would add that. And as far as how do you get a hold of me, I have a super neat Facebook page, which is actually my practice page, which is probably the easiest way. And I can provide you, and maybe you will share this out. I have a link if you want to, if you know someone who has autoimmunity or inflammatory bowel disease that wants to work with me, or just set up a quick call to see if there's some way I can help or find out how it might work. I can give you a link that you can set up a free 15-minute call with me, and we can certainly talk it through. And if you want to try any of those products that I talked about, I'm happy to share that with you as well. So.
Wow. Yeah, that's amazing, and an amazing offer to do that free 15 minutes. I'm sure a lot of people would be interested in picking your brain during 15 minutes to see sort of what your take would be on their situation. So appreciate all of your time today, taking time to be with us and share your wisdom with us and our audience. So again, Dr. Christina Campbell, thanks so much. Have a fabulous day.
Thank you. You too. Thanks for having me here.